Hello, welcome to our video. My name is Simon Constable. I'm the senior vet here at Simon Constable's Equine Vets, and this video is just an attempt to show you the brand new facilities that we've got. It's been a long hard road to get here, but we finally got here, and I'm very proud of what we've achieved here. We've got some fantastic new facilities which we'll show you around in a few minutes. Here at Simon Constable's Equine Vets, we're an independent veterinary practice. We're a family-run business, and we're proud of that. We're proud that we've got the passion and the care for our clients and our clients' horses. Renovating these facilities really is a gargantuan task to get everything ready. It starts off with various different problems, different pitfalls that you never thought of before, such as having a roof which is strong enough to take a horse's weight and more, and the steel frame that had to be put up, and then just the massive amount of breeze blocking that needs to be put in, the roofing. It really was quite a challenge at times, and then as well as that, there's lots of other things like the flooring has to be put in. These things that really I'd never considered before we started this project, but it's finally been done. It's taken quite a while. It's been over 2 years of almost constant work, and as I say, very challenging at times. So when you arrive at Heaps Cottage, you'll quickly realise it's a lovely, peaceful, quiet, tranquil area. There's even roe deer in the fields sometimes, and that gives us a nice atmosphere to work in, a nice atmosphere for the horses. The car parking, the trailer, the horse box parking is fantastic. Lots of room to turn round. And when you unload your horse, you bring them round to these facilities here. These are the vet stables, purely for the vet horses, the inpatients. We also have a level pad for doing the J&B measurements that we use here. But then any horses coming into these boxes, they go in. Obviously, we've got Bedmax shavings, which are good quality shavings to have on the ground. And then if we are dealing with any horses, we'll bring them down from this area here down into our facilities. So here we are in our new stocks facility. This is one of 2 sets of stocks we've got. We've got the original stocks from the old building, shall we say, where we do quite a lot of procedures. This is also a newer set of stocks that we've got, where we do a few more procedures. We do things like lameness investigations, nerve blocks, joint blocks, ultrasound scanning, x-rays or radiography. These can be done in both of them. Much of the reproductive work tends to be done in the older stocks, where the door's slightly different arrangement for different size ponies. Here we tend to use anything that's requiring a bit more involved procedures. And certainly the more involved procedures we most commonly do here are things like general anaesthetics, various reasons for doing those things, but any horse that has to be knocked out to do a procedure, we would bring them into here. So this is where the journey begins. They're brought into this area. They normally put into these stocks. The horses, lots of headroom, lots of room in these stocks. The horse is taken in, and then it's they're normally pre-medicated, so that they've got some sedative on board. They've got various drugs to help with the anaesthesia. They have an intravenous cannula placed, and that's normally tied in. That's also put with an extension kit, an extension set, to try and make sure that we've got control of the vein. Then after everything we've prepared, everything's ready for the horse, it's then taken through into the knockdown box, usually quite heavily sedated, which is the pre-medication really, where it's given the induction. We're now moving through into the new area, the knockdown box. You can see here it's a relatively small room. That's quite important for knocking horses out and for them waking back up again. These walls are all padded with the latest state-of-the-art material, certainly the ones that are used in the university hospitals around the UK. The horses are taken in here, as I said previously, they're pre-medicated, so they're sedated quite heavily. They're then given the induction drugs, and then the horse goes down in a hopefully controlled manner, fast asleep. We then use this winch put all the legs together in certain ties and then hang them on the winch, and then they're taken out of the knockdown box once they're fully anaesthetised and once we're happy that they're safe to move. Here we are in our new operating theatre. As you can see, plenty of room, a lot better than the old facilities we had, which were tight, quite cramped and quite tight. We've got lots and lots of room. We've got a hydraulic table. We can do most things on this, and certainly these sort of facilities now make us on par with many of the leading equine hospitals in the UK with the facilities available and the room available. It means we can do most things here, things like the orthopaedics that we were talking about, things like arthroscopy. It also allows us to do many of the other procedures, a lot of soft tissue procedures that really without these facilities, this bed in particular, and all the flooring and all the environment, we just wouldn't have been able to do. We have an ambulatory part of the practice. All the vets have 4x4 vehicles, which is really important in this part of the world, particularly in the winter. It means we can gain access to most places, certainly if a vehicle can get there. A really important part which has also been revamped, and that's the office. This is the heartbeat of all veterinary practices, and the new office facilities that we've got, like a new phone system which has been vital, but even more so we've got a new practice management system called Eclipse, which was originally developed for Rossdale Equine Vets in Newmarket, one of the most prestigious practices in the UK and even in the world. And this is one that they've now sold to various other practices, ourselves included. And this has made a massive difference with our ability to carry around on an iPad or even on our iPhones all the information that we need about the clients, and our ability to check on the treatment given as we're actually on the yard by the patient side. So you can see there's been a tremendous amount of improvements here at Simon Constable's Equine Vets, and we are going forward. We are looking at improving what we're doing constantly. We want to be the best. We want to provide the best possible service. We're a caring company. We constantly are doing things with our vets, further training. We've got regular clinical meetings with the vets. Every week we have meetings. We provide all the out of hours ourselves, and even cover for other vets when they can't handle their out of hours. We always provide opportunities of second opinions and referrals, so we do have that as a string to our bow. We've already improved our equipment and are constantly doing so. We're constantly upgrading and getting the latest equipment, be it x-ray machines, gastroscopes, endoscopes, arthroscopic shaver systems, arthroscopes, and anything we can do surgery with. So we are really, like I said, going for that high standard that we hope is what you're after, and we hope you can join us on this journey. But at the end of the day, it's all about the horses. It's all about looking after these animals that we all love, and that is the important thing with all this. I think enjoy your horses, make the most of them. We've seen at first hand what things can go wrong, and really how much you should not take them for granted. So we would encourage you as much as possible to spend the time and enjoy that time with your horses. So thanks very much for watching the video. I hope you've enjoyed it, and we'll look forward to seeing you soon.